Welcome to episode 8 of the Lymphatic Massage Therapists Book Club. So we are looking at chapter 8 of High Definition Body Sculpting, and this is the male liposuction client. So I like this chapter. The first thing I want to point you at is on page 96, and it's the idea of stealth incisions. So the author has listed out the areas where he puts the incision for where the cannula goes in, and these may be different from the areas that you see in a regular liposuction client. So he talks about where he puts them in the pubis, in the umbilical, in the nipples, which I had not thought of before, but he does put a cannula scar in the nipple, and then the anterior axilla fold. So that is, sometimes when I ask clients where they got liposuction, they're not quite sure, which is another conversation entirely, very interesting to me. They're not quite sure where they got liposuction. So you really have to look at the scars here and here, like to just confirm that the arm was worked on if they're not quite sure if the arm was worked on. So what's another one? There's a lot of great pictures in the chapter, and they talk about transition zones and negative spaces. So this is where, like, the dark purple is where you'll feel more of that hardened tissue because they took out more fat in the area. Interestingly, another concept that's in these chapters about the male abdomen is you have to be, I would recommend that you be really, really clear with the client who has had this body sculpting procedure as to if there is any fat transfer to the abdomen in order to make certain areas look larger, like to make muscles look larger. And this may happen in the arms as well, where there will be the liposuction, but then also the fat transfer. And the fat transfer is something that lymphatic therapists, we could move that. Unfortunately, we can move the adipose tissue right out if we're doing a really good massage, and we're moving fluid out, we're moving swelling out. We might inadvertently affect that fat transfer. So just make sure that you know exactly what happened and if any fat was transferred back in. And then my recommendation would be to not go near that area with lymphatic massage for 2 to 3 weeks. And then another thing, which I'm really glad I learned, is on page 103 right here, and I'll read it to you. Warning, always follow the real anatomy of the patient, no matter how awkward it may seem. If you fail to find and achieve the rectus inscriptions, when the patient starts dieting or exercise, they will observe double inscriptions and a failed result. So before I would have interesting thoughts in my mind about that doesn't look like the classical, six-pack. What was the doctor really thinking? And now, knowing this knowledge, the doctor has to go with the six-pack that is genetic to the client, with the undulations of the borders of the muscles as they are in the client before the surgery. You cannot remake it into a more even or aesthetically pleasing rectus abdominis, because if the client loses all the weight and starts building their own rectus abdominis, their own inherent six-pack, it'll ruin the results. So now that I know that, I'm like, that comment won't even enter my mind, because I'll know that this is the correct placement of this liposuction for the client, and it will help the client in the future if they do diet and exercise and start to build their own core muscles. So that is it for this chapter of High Definition Body Sculpting. Thanks.